Both HIV and TB are the leading killers here in Malawi and in much of sub-Saharan Africa. And although we've made great progress here in Malawi at tackling HIV and TB, we still have quite some way to go. In fact, if you go out into the community in Blantyre, you will still find many people who really struggle to get a prompt diagnosis of either TB or HIV. And together those conditions, if they are delayed in being diagnosed, can make people really sick, or they can even pass infection to their family members or friends as well. One group of people we know that are particularly affected with tuberculosis are men. And your viewers may not know this, but here in Blantyre, in Malawi and in many countries across the world, men are twice as likely to become ill with tuberculosis as women are. And that's because of the ways that they mix together, the risk factors that they're exposed to at work, and some of the close mixing that happens in social spaces such as bars and in workplaces and things like that. And so we have a project that's funded by the UK government called the LIGHT project, and that's really trying to increase the diagnosis of TB amongst men here in Blantyre, as well as in other countries across Africa as well. And we know that men, and I'm a man myself, but men often, if you're sick, you delay going to seek healthcare. You think, I'll put it off. I can't take time off work. So we think that by going out into the community, offering screening right there in the community, we might be able to reach those men who otherwise don't come to the health services. The overall mission of our group really is that we're committed to ending the HIV and TB epidemics here in Malawi and globally. Really, to make a difference, you've got to understand what the community think about illness and what the policymakers and other people making decisions, how you can influence them to help them change policy to improve health. More recently, in some of our studies that we've been doing here in Bangui in Blantyre, we've been looking at new artificial intelligence software for diagnosing tuberculosis. So that's instead of having doctors or nurses look at x-rays, having computers look at x-rays. And we're really hoping that will be a great way to speed up the diagnosis of tuberculosis. We should be proud of what we've achieved within the public health group. The team that we've worked with, the communities that we work with are really, they are the people that that really drive us to do better quality research. So I have great hopes for the future and great hopes for the future of Malawi. Still last year, 1.5 million people died of TB throughout the world. Let's get that down to 0.